You see this guy here? I'll tell you something about him, but before I tell you, I blocked his face, okay, just to hide his identity. Before I tell you, let me tell you what happened. So, last month, in July, he reached out to me. He had something called disc degenerative disease. In layman's term, his spine is already melting. You understand? His spine, the bones that make up his spine is melting, so he can't stand straight for some time. He can't kneel down, he can't sit down. He's always in pains. He has tried everything. Let me show you. Anything I do, I like to come up with evidence, so you go to see I'm direct. You understand? And I'm not making shit up. So this is his x-ray. He sent a lot. I just screenshotted only one. Medical report, everything. He has tried all sorts of treatment. It's not working. He said, please help me. I'm still a young man. This disease is for old people. So why is it happening to him at a young age? I said, don't worry. You have come to the most powerful native doctor in the world. Let us see what we can do. This is 24th June. That was when he reached out to me. Look at it. I watched one of your videos when you talk about waist pain. If I stand for long or sit on for long, I will be having waist pain. I have done x-ray and even so many tests. Okay. On the 12th of August, that was when we actually started the treatment. That's when he reached back. So I asked him, show me a physical picture of you. I wanted to see. You know, with my spiritual eye, I can tell a lot about your state of health by just looking at you. You understand? So look at the dates. So he showed me. This was the picture. This was the picture he showed me. I saw what I was looking for in the full picture. I said, okay. I told him what to do. And I told him to reach back to me after 1 month, which is 4 weeks. This was 12th of August. On the 30th of August, roughly 2 weeks later, he reached out. He said, good morning, sir. Since I stopped eating the food you asked me not to eat for now, I noticed my back pains had stopped, except the waist that is left to heal permanently. I now said, wow, this is great news. Share a recent full body picture of you. I wanted to see whether his body is actually healing. My spiritual eye. Don't try me. I'm still the most powerful native doctor in the world. Don't try me before I suspend you for air. Now, if you want to know who is tracking you on TikTok, click this arrow and hold it. The second person there is the person tracking you on TikTok. So I asked, hope you are applying the oil around your waist. There's an oil juju I mixed for him. I told him to mix, right? And be applying on his waist, on his spine, so that the spine can heal. He said, yes, sir. So I cut out a lot of discussion. All right. This is his recent picture. As you can see, he's full of life. If not that I blocked his face, you would have seen. He's full of life now, looking fresh. He'd be like, who want go do modeling? You understand? Okay, so you've seen the progress, right? So let me teach you some things about herbs. When it comes to herbs, there are things you need to know. Herbs are natural. They are basically dietary supplements. Things that you should have been adding to your food that you've not been adding, essentially. Okay, so now when you are adding them, magic is not going to happen on day 1 or day 2, except in rare cases. I've seen somebody that their blood pressure corrected under 1 day. You understand? Because it's not that bad. The person's organs are still good. You know, if you're having blood pressure issue, it gets to a point that it starts damaging your organs. So there's organ damage. You can't expect miracle under a week or 2. Your organ has to heal back. You understand? So that's why some things, if it's infection, right, you're expecting healing in 14 days, around that time, 21 days. If it is a swelling, you're expecting it to come down between 1 to 3 days. Swelling, like, so a part of your body is swollen. Even if it's not fully down, at least if you look at it after 3 days, you should see big difference if the herb is working. You get, if it's organ damage, you're talking from 6 weeks up. So that's why when I give people herbs and say, and I know it's organ damage, I say get back to me after 6 weeks. So there's a reasoning behind that timing. You understand? Or 3 weeks, depending on what is really happening. If it is bone, something is wrong with your bone, it takes 3 months. If it is fertility, 3 months minimum. that you will take the herbs. Say you are looking for a child and I conjure one juju like this to give you a child, to make your body be able to produce a child. 3 months minimum. Both sperm and egg, they are around that same 2.5, 3 months for them to regenerate. You will now add like an extra 1 month of your body healing. So we're looking at 4 months to 6 months for most people. You get, I've seen a woman that under 2 months you don't get belly. Mostly because she doesn't have any issues. It was the husband that had issues. Her issues were there, but it's not enough to prevent pregnancy. But these are rare cases. Most people, fertility issues, 4 to 6 months if I'm giving you any herbal treatment or remedy. The reason herbs take time is that they are not extracts. It's just like telling you add most of the herbs, not all, but most are what you have always been using to cook. Most people will have it in their kitchen, they will not use it to cook. Many people don't know how to cook these days. Once they don't add seasoning, they will think the food is done. They're thinking that our ancestors are stupid for adding all those different ingredients inside the soup. The soup our ancestors were cooking is just for healing. It's like herbal concoction. That's what soup is. But people will remove all these things and add seasoning. If they don't know what to do, they will add 10 cubes of seasoning. Some will even add sugar and think they are cooking. You are cooking poison, madam. Some people, I'll tell them what to take. They'll be like, what? I have this in my kitchen. I say, why haven't you been taking it? So those things, if I get, for instance, if I get bitter leaf, right? You know the way we cook bitter leaf soup. Bitter leaf itself, it has a lot of compounds. But the main one you're looking for might just be one. The one that is going to heal you for that particular thing you're suffering from. And I say, drink bitter leaf water every morning. As you're drinking it, you're drinking all the compounds with it. You understand? It's going to take time to gradually heal you. Take some days or some weeks for you to start seeing even any effect. But if you now go and buy a tablet or you want to take an injection, the injection is the extract. They might even extract that active ingredients, turn it to a tablet. So that small tablet like this, if you take 2 or 3 of it, it might be overdose. But if it's bitter leaf itself you are drinking, you can drink 3 cups, nothing will happen. You go just bitter for your mouth. Nothing. You understand? Because it's not extract. Now, those herbs are coming from nature directly. But if you're taking drugs or injection, these things have passed through lab. Some smart scientists have sat down in a lab and constructed it to be like a hack. Like your body is like a car and the scientist is like a mechanic, fashioning something that will fix your body. So sometimes the drugs go in there and block your body from performing a certain thing so that this other thing can correct. For instance, if your blood pressure is high, you can take something like calcium channel inhibitor. You go block certain things for your body, your blood vessels will relax. You understand? If your blood pressure is like 180, 190, if you go to hospital, they might give you a tablet you put under your tongue. Under 30 minutes, 1 hour, it don't come down. Because it's a hack. But will it heal you? That's the question between you and your doctor. Abi, you go to take them every day. You get what I'm saying? I know I will not say everything directly, but you get what I'm saying, right? Maybe that your blood pressure has reached to the point that it has started damaging your kidney. There's nothing you're going to do for that blood pressure to permanently correct unless your kidney is healed. If you have had consistent blood pressure for a while, go and check whether your kidney is still okay. If your kidney is still okay, you have chance of healing is more possible that way. I'm choosing my words carefully, but you get what I'm saying, right? If you never damage your kidney, you are still in a very good position. But some people, the thing don't reach where it don't damage kidney. Arteries are already clogging up. You get? So healing has to start at this level. And it takes weeks. So some people, under 1 or 2 days, they give up. You get? There was a woman, right? The left chest is swollen. So they have tried everything, no way. So when they reached out, I said, okay, since we don't want to try herbs, first thing you will do is go and mix this oil, apply on it. Give me feedback after 1 week. By day 3, they reached out to me again, a snap picture and say, it is reducing, no. The thing don't they shrink. I say, it never reach, it go still burst. You understand? It go still burst. Just they apply the thing, they go, morning and evening. By day 5. The reason I did not recommend any drugs for them to take is because they were already taking drugs by their doctor. There's a set of drugs. So this one is just the one they will apply on their body. I said, okay, this is, go and find this thing, put it on the mouth where that thing was, just place it there, it's going to magnet. I thought about that thing the other day, I just don't want to mention it here. It's a special kind of stone. I said, put that stone there, it will magnet. You understand? After 3 or 4 days, it will fall off. Anytime it falls off and you put another stone there, if it doesn't hook, that means healing has happened. Complete. Now, traditional medicine, I'm not a medical doctor, no one yourself. I'm telling you how we do it in traditional way. Do you know these people gave up by day 5? They gave up by day 5. So, but they had the courtesy to tell me that they are giving up, or they want to go, and I said, okay, no problem. You understand? It's not everything I will say, but you get what I'm saying. I've had issues where somebody was infected. Because of that infection, there was a growth and inside their belly, and the medication that they are being given is not pointing to dying. It's not tackling the infection. It's just tackling the growth. You understand? I say in herbal medicine, the first step is to tackle the infection. So this is the test you're going to run. Go back and meet your doctor. Say somebody say you should run this test to confirm whether this infection is there or not. They went and ran it, and they confirmed, yes, she has the infection. I said, why would I not run them since? So this is, you have to tackle that's the infection, right? Is what is causing that growth. So I told them what to do to tackle the infection. 2 days, they gave up. They called me, they said they don't want to this, that. You know? 2 days, they gave up. That giving up now resulted to something else I don't want to say. You get what I'm saying? So if you are taking herbs, just take it as, know that it's dietary supplements, things that have been missing in your body that you just want to. In fact, sometimes, right, I tell people go and see a pharmacist. Show them this test result. They will tell you the drugs to take. You understand? Sometimes you can get the supplement from drugs in the pharmacy direct. Instead of you going to mix this herb and that herb, just go and get the ready-made one from the pharmacy and drink and get yourself. You understand? The only time you use herbs is maybe it's not available in the pharmacy, or the one in the pharmacy is not trusted based on your circumstance. You get what I'm saying? You are trying to recover. You understand? So at the end of the day, if you are taking herbs, just know it's not magic. Do you know that some herbs for BP, right? It takes 4 weeks for you to see the first effect. So sometimes if I give it to you, I can say, come back in 6 weeks or come back in 8 weeks. I know that around 3rd and 4th week, you will start seeing effects. So you can take every day or 3 weeks. If they check your BP, you not go see anything. All of a sudden, 4th week, bam, drop in 10 points. 5th week, bam, another 10-point drop. 6th week, you don't enter 130s. Person with the 170 before. So some things take time because your body is healing. Because most of these diseases, it took years for it to marinate in your body and mature. I know some people right now, some young people in their 20s, they are mixing codeine. Yeah, their tongue is blue. They are mixing things. This person at 40, if you see how many diseases that will be in their body at 40, mix codeine, mix this, you smoke this, you drink that one. Because you are young, your body is able to recover every 24 hours. You know, because you are young, you don't feel it, your body is able to recover. But guess what? 35, you don't go mad, you are crazy. It has messed up your brain. You know, 40, you have high blood pressure, you have diabetes, you have kidney disease, you have different things. Your liver is out of control. Cancer of the this, cancer of the that. You'll be asking where did they come from. Now the things you have been taking for years, and this is like 10-20 years of taking rubbish. So when you are now taking things to heal you, you expect miracle under 2 hours. You understand? Herbs are not for emergency. If somebody has an emergency, maybe there's an accident or somebody collapsed, that's not where you want to be mixing herbs to. In a hospital, you're supposed the alarm not reach your side. Herbs is when you are still okay. So disease dey your body, you are still okay. You know, not be when you don't collapse. and they need emergency treatment, or doctor is telling you need instant surgery now, you are looking for herbs. No, you look for herbs when you still have 1 month, 3 months, 6 months out. You understand? That's when you try herbs. Herbs is trial. You understand? Just like any other treatment, you are trying to know whether this one will work for you. You get? For most people it works, but it doesn't take away the fact that you are trying it before you do the ultimate surgery. Because the thing with surgery is, there's nobody that undergoes a surgery that remains the same. That's what all these cosmetic surgeries don't, surgery patients, they don't know. Once you go under the knife, something has changed in your body. You understand? Once you go under the knife, they're either removing something or putting something. Your body can never remain the same. You get? Something has left the way your body is supposed to be. Something has left it. Many people that did surgery, they are never, go and ask them. There's always something that comes up later. So if you are preparing for a surgery, and something is telling you that you should try herbs, and that surgery is not immediately in your front, maybe it's 3 months out, or doctor don't tell you, say sometime in future you will need surgery for this, that's when you try herbs. Not when you are about to die. Your reading is flatlining. That's when you want to mix bitter leaf with. No. You treat yourself when you still have time. That's why I tell people, try and find out the root cause of, if something changes in your body, find out the root cause immediately. You get? Find out the root cause immediately. Like if your hair is changing color, it's not normal. Why would your hair change color before 70? 1 or 2 gray hairs is not bad, but we're saying 25-year-old, 30-year-olds now, everywhere on gray. You go just the work out because you are still physically fit. Until one day you collapse before you now know that you have heart problem. But that thing has been giving you sign for years. Some people, all of a sudden, they are not seeing well again. What they will do, they will go and get eyeglass from an optician. After 2 or 3 years, the eyes get worse. They will now double it. The eyeglass will be getting thicker. Until one day, boom, they collapse. What happened? Diabetes. They have been having high blood sugar since. But they did not check. They are just patching up the symptoms. That's when you collapse. That's not when you start looking for herbs. You get? Because that time you will not have the patience to stay through, to see it till it works. That time there's an emergency. If you are taking hair under 2 days, you will be like, they work. People have died like that. Something that is actually working, but they don't get patience to see it through. They go change this, change it. It's not by. So watch your body normally. If every morning you normally wake up from bed without any problem, all of a sudden you start waking up with struggle. Or they snore before, all of a sudden you start snoring. Yeah, your alarm should go off. Something is wrong. What is going on? Why am I snoring? Snoring is not good if you just suddenly started snoring. Some people are born just like that. That one is different. But normally you start snoring. Go and check your blood pressure. Go and check your heart condition. You get? Maybe you are gaining too much weight. It may be a sign that your blood sugar is high. You don't the top weight. You understand? Your throat, your breathing space, your air spaces are started blocking. So small changes in your body, you'll be like, nah, this is not normal. I've not always been like that. Some people is lack of energy. You go just wake up, just get energy. It could be like you want to go back to sleep, but you are not feeling sleepy, but you just don't have energy day after day. Your normal 100% energy is down to like 20%. It's a sign that something else. That's the time you follow it up. You go and see your doctor. You try and trace the root cause on time. It's not when you collapse. They say they want to do brain surgery and change your head complete. You start looking for native doctor at that point. Yes, he may be able to help, but that's a bit too late. That's a bit too outstretched. As a woman, press your breast. Check whether you have lumps. That time you still have lumps, it's painless. That's when you should go and try and see a doctor or look for a solution. It's not when the thing don't turn to you understand? It's not when it's now turn to before you now know. By that time it may even affect your liver. Do you know that? Especially if it's on the right side. On the right side, if you have breast, it will affect your armpits. So this your hand now no go to come down. Bam, it don't go to your liver. All of this side now don't go. As they are battling the swelling here, they are battling the chest, they are battling the liver, bam, it don't cross to the other one. I'm telling you the truth. All because you are not paying attention to your body. You pay attention. If normally you climb the staircase with ease, all of a sudden when you climb the staircase, you are panting. You want to sit down and relax and drink water just because you climb your normal staircase. Something is wrong. You understand? Something is wrong. You're supposed to be on alert. Why is my staircase tiring me out? All of a sudden you get knee pain. You are managing your knee pain. You don't manage knee pain. Doesn't just naturally happen. You know what thing don't go wrong in your body before your knee will suddenly start paining you. No accidents, no nothing. All of a sudden knee pain just appear. Alarm no reach your side. Many people that have knee pain, persistent knee pain, chronic knee pain, also have heart problem. Many people that have knee pain have high blood sugar. The sugar is high. The effect is knee pain. Many people that have knee pain have autoimmune disease, that is arthritis, which means another kind of autoimmune disease is coming. You are still battling knee pain, all of a sudden something else don't. You don't get something like vitiligo. It will look unrelated, but it's related. You are having autoimmune disease. Your gut microbiome is messed up. I don't know if you're getting what I'm saying. So that's just life. Knowing these things early on, and then you apply a therapy. You look for solution early on. You get solution if you find it on time.